Muscular dystrophy, a 2-minute class for paramedical. Muscular dystrophy was first described in 1830 by Charles Bell. The word dystrophy comes because of an untroph or a disordered proliferation. So in this case, I find this dark pink are the muscles and this is the fat spaces. Whereas here, this is a normal muscle that is present in us. So look at the abundant muscle and lack of fat, whereas here there is scarce amount of muscle that is present. And there can be increased amount of creatinine in phosphokinase. So this is the Duchenne is one person who identified the Duchenne's muscular dystrophy. So normally you find that there is a contraction force which is affected by means of this disorder. So dystrophin associated protein complex is formed which leads to this disorder. It is a muscular dystrophy, clinically and genetically heterogeneous group of disorders. So the types are Duchenne's, Becker's, congenital, distal muscular and limb girdle. And look at this particular patient, you find that there is a bending that is seen and there is a thickening, seemingly thickening calf muscle, but it is actually weak for the patient. He is bending laterally also. So this again is a normal muscle. Here it is muscular dystrophy, increased amount of fat. So mutation can be there and that is responsible for the contraction of the muscle. Muscle is ultimately replaced by fibrous tissue and fat, and it can be X-linked disorders. And not only the skeletal muscle but cardiac muscle and respiratory muscles can also be affected. The signs and symptoms are, look at this one, the child is finding it difficult to get up. This is called as Gower sign. So it tries to gain various support before ultimately standing up. Gower sign and Duchenne's muscular dystrophy. So there is muscle wasting, poor balancing, scoliosis or lateral bending, spasm, inability to walk, and there can be deformations. Respiratory and cardiomyopathy can also be present. The treatment, there is no treatment at all. Gene therapy can be attempted, and these are all some drugs which have been tried. Physiotherapy, surgery, assisted ventilation are all needed, and there should be education to the family of the patient.